Good health. It's all about balance and staying in tune with your body. But intuition isn't enough. Having regular screenings is vitally important to your long-term health. And now, the latest advances in diagnostic technology can be found in a beautiful, relaxed atmosphere. Introducing our all-new Women's Pavilion, dedicated to the healing arts and clinical needs of women. St. Tammany Parish Hospital. World-class healthcare for women close to home.
Hello and welcome to Healthy Living. From St. Tammany Parish Hospital and the parish government, we host this half-hour show each month to bring healthy living choices to the people who live in St. Tammany Parish. Our guest today will be talking with us about the St. Tammany Parish Hospital Community Wellness Center and an exciting new grant they've earned that will enable them to bring some healthy living and lifestyle choice opportunities to West St. Tammany. They'll have healthy choices in restaurants in conjunction with Eat Fit NOLA. They'll be launching Eat Fit North Shore. They'll have 2 community gardens, one in Mandeville and one in Covington, and they'll be teaching people how to shop smart in the grocery stores with their store tours. With us today first is Sandy Matthews. She heads up the Community Wellness Center. Good morning, Sandy.
Good morning.
Glad to have you here.
Thank you, Melissa.
Tell us a little bit about the Community Wellness Center to start.
The Community Wellness Center is a 3-way partnership. We are partnered with St. Tammany Parish. They provide the building and the maintenance. The staff are all members, employees of St. Tammany Parish Hospital, and we provide services under contract with the Department of Health and Hospitals. Some of the services that we provide are the WIC program, which is for women, infant, and children. It's a food supplement program. We also do childhood immunizations, vaccines for children. Some children qualify for that, and if you do not, we also accept insurance and self-pay. We do the Nurse Family Partnership Program, which is a program for first-time pregnant moms. You have to be Medicaid eligible, but we do pair you up with an RN, and that RN goes out to your home and provides parenting lessons, teaches you all the skills, helps you to set your goals, and after the baby is born, they stay with you until the child is 2 years old.
That's wonderful. It's a great program. Yeah. So the Community Wellness Center then is provided by the parish in terms of its building, staffed by the hospital in terms of everybody who works there, and then your programs are driven through DHH and grants.
That's correct.
As well as the hospital's goals for the parish.
That's correct.
Outstanding. Well, we're talking specifically today about a grant that you've earned, and it comes through WIC and the CDC.
Yes, the WIC was provided by the WIC National. The grant was provided by the WIC National Association. It is funded by the Center for Disease Control, the CDC. And there are other organizations that are part of this grant, including the American Heart Association, ACOG, the American Planning Association. So each organization has been given a directive. Under the WIC directive, we are to bring healthy choices to our community. So what we're trying to do is create more access. And it's like you said, we're going to do the Eat Fit NOLA. And with the Eat Fit NOLA, I'm working with Molly Kimball, who is with Ochsner Health Systems. And she's going to bring this program to the North Shore, and we're going to call it Eat Fit North Shore. We plan to partner with the local restaurant owners and chefs and help convert some of those choices, entrees, into healthy choices. And in order for it to be considered a healthy choice, it has to meet specific criteria. For an example, it would have to be less than 600 calories, less than 800 milligrams of sodium. That's all criteria for the American Heart Association, but Eat Fit North Shore was going to take it a step further, and it's going to be less than 5 milligrams of sugar and no white starches. So it's going to go a little bit further.
It's going to be very healthy.
Yes.
Okay. And what's established on the South Shore already, Eat Fit NOLA, is something that we see Molly Kimball in the paper and through her work with Ochsner Health System, pairing up with those South Shore restaurants. And so Eat Fit North Shore is the same principle, but over here in West St. Tammany as well as other areas if we spread it. Is that right?
Yes, Molly has more than 70 restaurants on the South Shore that have already become Eat Fit restaurants. On the North Shore, we only have 2. We have Dakota, So if you want to visit Dakota's and check out some of their entrees that are Eat Fit entrees, you won't even taste the difference. They taste just as good as the ones that haven't been converted. We also have Copeland's.
Great.
Copeland's added an additional component to theirs. They are also offering healthy choices to children.
Oh, so their children's menu has some
Yes,
healthy.
yes.
That's wonderful.
So.
Okay, and so your goal with this grant is to have more restaurants participate on the North Shore. So if local restaurateurs are interested, or folks who have a favorite restaurant want to see their favorite be a part of Eat Fit North Shore, they should reach out to the Community Wellness Center.
Yes, and they can reach, can I give a phone number?
Absolutely.
985-871-6078. We already have approximately 7 restaurant owners that are interested, so we can take 15 under our grant. We hope that we'll continue to grow this as time goes by, but within our grant component, which will probably be for the next 8 months, we have a limited amount of restaurants that we can
Great.
service. We're going to
So
take 1 per month.
We'd like to see about 8 more be interested and join us, so we'll get up to 15. And the idea is that those chefs or owners would pick out items on their menu that they'd like to qualify for Eat Fit North Shore, and your nutritionist will review those and use some software that helps them analyze what's in that recipe. And then they'll come back to the chef or owner with some guidelines about how to bring that calorie count down, or that fat content down, or maybe the added sugar or sodium particularly is one of the things we find restaurants need to adjust. Is that right?
That's correct. And sometimes it could be as simple as just changing a sauce and a gravy. We have a team, we have a strong team, the team that will consist of a dietitian, a registered dietitian, 2 WIC nutritionists, an RN, and we also, we're proud of this because we're going to have 5 interns from SLU that are majoring in family consumer science. They're in their senior year, so they are going to be part of this project also.
Wonderful. So we're growing the next generation, we're making some healthy choices in restaurants, we're involving the local economy. Sounds like a win-win-win.
Yes, and the next generation, you can tell that they are being educated on reading the food labels and making healthy choices. I have several grandchildren, and when they come to the house, they are looking for healthy snacks. I can no longer pull the cookies out.
That's a good thing.
They want the yogurt, but you got to be careful with the yogurts, and Joey will talk to you a little bit more about that when she comes on. But some of the choices that you think are healthy choices, they're not. They are, they have a lot of sugar in them. So you have to read those food labels, and our children are, the younger generation are. So this is
Informed consumers. Well, we're excited to move through this episode of Healthy Living. Sandy Matthews is with us, along with some other members of her team, to talk about Eat Fit North Shore, about grocery store tours, and about community gardens, all thanks to a grant that the Community Wellness Center has earned from WIC. We'll be back after this.
Now that St. Tammany Parish Hospital and Auctioner are working together, advanced pediatric specialists can treat your child's most complex conditions close to home, giving you the peace of mind that comes with knowing your kids are in good hands.
We're back with Healthy Living, your half-hour show each month with the parish government and St. Tammany Parish Hospital. Our mission with this television show is to help people who live in St. Tammany Parish Hospital make healthy lifestyle choices. And today we're talking with people from the Community Wellness Center about a new grant they have that's introducing 3 exciting programs that help with healthy lifestyle choices. We have Janine Chevis with us next, and Janine is a registered nurse with the Community Wellness Center, and she works with the WIC program. Welcome, Janine.
Thanks, Melissa.
Tell me a little bit about what you do at the Community Wellness Center.
I'm a nurse at the Community Wellness Center. We do mainly the WIC program, which Sandy mentioned earlier, but it's a pretty comprehensive nutritional education program. We monitor children's growth, pregnant women, pregnant moms, etc. So we're looking at those things and then trying to do some nutrition education with that, as well as vaccinations and different programs of that nature.
Great. And your focus today is one of the 3 parts of the WIC grant that we're talking about, and that is the grocery store tours. Nope, the community gardens.
Community gardens,
You're going to talk
exactly.
with us about the gardens. So we're going to have a garden in Mandeville and a garden in Covington.
Yes,
But
yes.
you just told me that there's a 3rd garden.
Well, we actually are going to partner with Joey Roberts at the YMCA. So we're excited to start Community Garden at his facility in St. Tammany in Covington. And that's going to be a great opportunity to incorporate participants at the YMCA, but he's also welcoming school children, trying to get the schools involved in this, which is exactly where we wanted to go with this program. So we're excited about that.
And the Community Wellness Center, the children who are in the WIC program, and the hospital's parenting center, children who are attached to that, are going to have an opportunity to learn about community gardens.
Yes, we are actually creating a community garden at the Community Wellness Center. So we're really excited about that because we will see on a daily basis how this project is going to start from inception and how it will progress to hopefully a fully fledged productive garden. So it's going to give us an opportunity to partner with those children and their moms and dads to come in and learn about gardening, which is the concept of a community garden, is to educate, teach folks that it's not that difficult to start their own garden, and hopefully they'll participate in the community setting but bring this home to their own home and just perpetuate it with their children and their children as they grow.
Right, because a lot of times we think, I don't have the time to keep up with a garden, or I don't have the space to grow a garden, I don't have the know-how.
Exactly.
There are lots of sort of mental barriers that keep us from thinking we can garden on our own.
Exactly. So we're hoping to show them that it's not that difficult to get it up off the ground. Mike Norman with the Bee to Grows Initiative has partnered with us as well. He's a coalition member. So he's bringing a wealth of knowledge to us about the ins and outs of starting community gardens from the ground up, and then how to maintain them. We're learning about seasonal planting, what needs to be planted when, how to start seedlings. So this is going to be a learning opportunity for everybody that's involved in it. So we welcome anyone in the community who would like to join and learn, because it's an opportunity to do both, but also to reap the benefits of what our garden is going to produce in the end.
And that reaping the benefits is one of the neat things about community gardening, because you can invest your sweat equity, you can come away learning a great deal about how to grow your own food, but you're also going to come away with some actual food you grew.
Right, right. So that's what we're excited about. And we've mentioned this to some of the class participants, and the children's eyes light up. I mean, the thought of, growing carrots, it's just exactly what they want. They want to learn that. So we're excited to hopefully get this off the ground. And with the Community Partnerships for Healthy Mother and Children, the grant, one of our initiatives and objectives is to increase access to a healthier environment. And with the community gardens, we're hoping to bring about that opportunity for everybody to get some additional fresh fruits and vegetables into their diet. So that's our goal.
Very good. Well, we talk in the food community about food deserts, places where people live and they're a distance from a grocery store, or that the grocery stores around them are more convenience store driven, maybe don't have a lot of fresh food to offer. This is an opportunity for people to realize that they can grow their own fresh food, that it's not as hard as it looks, and that when you know the tricks, you can even garden in pots right outside your door.
Right, right. And Mike Norman is teaching us that if you have the space, sunlight, and water, that's the three components, and pretty much everybody, it seems like, could find that. I'd like to mention the garden in Mandeville as well. We have a wonderful garden site on Kleber Street, which in the past was a community garden, has been left. It's been left unkept for a while, but we are going to take that site in, and it's going to be a wonderful opportunity for the folks in Mandeville too. It's in a neighborhood area, so it's going to be accessible to a lot of people that can come in, that live, in that area, to come in and participate in that. So it's a nice site, and we're definitely looking forward to developing that.
So fantastic. We've got Kleber Street in Mandeville, we've got the YMCA in Covington, and we have our own little community garden coming soon to North Florida in Covington, right by the fairgrounds, because that is where the parish government provides us Community Wellness Center and Parenting Center space.
Right, right. LSU Ag Center, I'd like to mention too, is also a coalition member, and they are certainly going to be a part of this venture with us to help. And there is actually an existing small community garden in Covington on 25th, West 25th. So it's already in place. And we are hoping to add a few beds to that and get some additional family members in place in that site as well. So it's really, we're looking forward to this.
So we're just growing the whole idea. We've got the Mandeville site, the YMCA, our Parenting Center and Community Wellness Center, and the existing one in the West 30s that you will help to grow and expand. theirs to serve more families.
Right. So that's our
Very
goal.
exciting.
That's our
And
goal.
you mentioned that we have a partner in Abita who's helping us.
Mike Norman with Abita Grows Initiative. So Mike was instrumental in starting the Abita Farmers Market in Abita. So that's really taken off and has been embraced by the community. So he is a wealth of information and is certainly helping us along with our community garden project.
Wonderful. And we have an enormous number of active garden clubs in West St. Tammany.
Yes.
Lots of master gardeners who need
Yes.
time in gardens to be
Yes.
able to maintain their status. So we should be able to find lots of volunteers to teach our citizens and children about community gardens.
Exactly. We would welcome anyone who wants to partner with us, join in this effort. If you can give an hour a month or 3 hours a week, we will take whatever you're willing to donate, because it's an effort that we want the community to come together and to really embrace this and get to know one another. It's a social event plus an educational event and a nutritional. So it's a lot of different factors we're hoping to bring together.
Outstanding. And if we have volunteers who want to get involved, or we have families that are interested in community gardening, how can they get involved? Should they call you?
They could call 985-871-6078. That's the number to the Community Wellness Center. And we certainly could get them on track with what's the progress with the gardens.
Great.
We're hoping to, in the near future, have somewhat of a community garden kickoff. So we will let everybody know, what's going on, when we're going to start cleanup days, planting days. So it's going to be a series of steps that we're working towards. So we're working on that as we speak.
Janine, thank you so much for teaching us about community gardens.
Thank
We'll
you.
be back next with the rest of Healthy Living, talking about the Community Wellness Center and their WIC grant for healthy lifestyle choices.
Which flavor? There's no right or wrong answer. The options are endless and can be as unique as our personalities, be it young or not so young. And when it comes to your family's primary care doctor, we believe you should have plenty of choices too. Exceptional care, custom made for you. Because living here means getting condensed milk every once in a while. St. Tammany Parish Hospital, a world-class physicians network close to home.
We're back with Healthy Living. I'm your host, Melissa Hodgson with St. Tammany Parish Hospital. We're talking today with folks from the Community Wellness Center, a program of St. Tammany Parish Hospital, the parish government, and the Department of Health and Hospitals. The Community Wellness Center is excited to tell us about a new grant they've earned from WIC and the CDC. And this grant is giving them the ability to bring 3 healthy lifestyle opportunities into the North Shore community. We have Eat Fit North Shore, which will be helping local restaurants to learn how to make healthy choices in what they offer the folks who come to eat in their restaurants. We have community gardens in Mandeville, Covington, and at the Parenting Center and Community Wellness Center. And we're going to talk next with Joey Skinner, who's here to tell us about the third aspect of the grant, which is grocery store tours. First, Joey, tell us a little bit about what you're doing at the Community Wellness Center.
At the Community Wellness Center, we actually are helping mothers and children, children up to the age of 5, as well as newborn infants. We are actually a supplemental program to parents and families who are maybe in need of a little extra food items. So we provide them with those. In order to provide them with the supplemental foods, they have to come into the clinic and they get educated on how to eat. And also we do lifestyle education as well. So for example, they may come in and get one-on-one education, or we may have a class where we'll do a group of education there. We kind of just go over healthy food choices. Their food package is containing of grains, and so we only provide whole grains. So we'll kind of explain to them the differences between a grain and a whole grain, so when they're actually going to purchase these items, they understand what they're getting. And so we also do provide them with dairy items, such as skim milk for kids who are over 24 months, and mothers also who are pregnant. And we also provide formula for infants as well. And so when we provide them with these foods, we also want to, let them know when they go to buy these dairy items why they're getting the skim milk versus the whole milk, and how it reaches their nutritional needs. So Yeah, so it's not just providing them with the food, but it's also giving them the knowledge when they go into the grocery stores of what they're actually getting.
Outstanding. So for women, infants, and children whose households are maybe having some trouble making ends meet, this is a program that helps them to have access to those healthy foods. But then you're also counseling them in, now that you've got those healthy foods, here's how to prepare them, here's why you want to choose this over that.
Correct.
And that leads right into this aspect of the grant that we're talking about today, the grocery store tour. So I know that I need to feed my family healthy foods. I've got my buggy. I'm on my way up and down the aisles of the grocery store. Why do I need someone to tour me around in there?
Okay, so we actually find that we actually did surveys at the Community Wellness Center just to see what the need was. So we're doing these store tours, but are people going to be actually interested in going to do these? So we did some surveys and we found that 100% across the board, mothers always answer that they want their children to be healthy, and they're also interested in it. So there is a need out there for it, but what problem we found is that when they go into the stores, they're not sure what they're buying. So they may go in with the mindset, I want to be healthy. But when you're used to purchasing foods that you've grown up on, or perhaps you are just busy, you're not able to actually look at the nutrition labels, or you maybe perhaps don't really know how to read them. So you're just seeing the labels on the boxes that say, you know, whole grains or gluten-free. So you kind of just go ahead and throw them in the buggy, and maybe the kids see something and they're grabbing the yogurt with the, you know, favorite cartoon animals, and they're throwing it in the buggy. So the store tours is going to kind of take within the store means we're taking the parents, the moms, around their environment, and we're showing them what they can do while they're in the store by actually taking the food item and just turning it over and just reading the ingredients, like the first couple of ingredients, to see if it's actually a whole grain or if it's actually something that may have, you know, an enriched wheat flour, and so they're able to say it's a whole grain. So little things like that are really going to make a difference. When a mom goes in there to purchase something healthy, they're actually getting that food item and bringing it home to their children. So.
Right, because as shoppers, as parents, we like to think we're bringing home the healthy choices, but just because it says healthy on the front of the package doesn't
necessarily mean that that's what we're getting. So, yeah.
My favorite thing is to grocery shop for cereal with my kids. They like to show me, you know, they bring a box and they see Mom, 9 vitamins and minerals, and I flip the box over and go, see the word ingredients and then a colon, and the first one is sugar.
High fructose corn syrup. Yeah, exactly. So some other components of the store tour is it's not just the nutrition labels and the ingredients and the whole grains, but we're actually going to be tying in a way to actually get the nutritious food at a lower cost. So sometimes when you're in the produce section and you're looking at all these produce and they have the chopped up carrots, the whole carrots, the organic carrots, or you may have canned carrots, frozen carrots, and it's like, which way do I go with this? So we'll actually be able to, you know, in the seasonal fruits and vegetables, while we're there, explain how that can be cheaper to purchase in season. If foods may be out of season, they may be more expensive fresh, but we'll go ahead and take them in the frozen section and show them, well, here it is, it's still low cost, you can still afford it. So we'll do the pros and cons, and also of canned foods and the longevity, but perhaps maybe there's more sodium in those, so you have to outweigh, you know, which is the beast that you want to fight, kind of. So we'll be doing the produce, and also the other component of that is, like Sandy had mentioned too, in the dairy section with the yogurts, the many different types of yogurts that they have out, and, you know, really reading your labels and seeing that a lot of these yogurts have 16, 17, 25 grams of sugar in them.
Wow.
And I know for a woman, it's only 24 grams for a daily recommended amount. So covering.
So if you have a 5 sugar gram yogurt for breakfast, you've got plenty of splurge left today.
Exactly.
But if you had a 25 gram sugar yogurt for breakfast, you're going to be eating lettuce for the rest of your day.
Yeah, and like I like to really look at it as to where you do your finances and you kind of budget out your money, but you also can kind of almost look at food in that way and really think, okay, I spent 5 grams today, I have, you know, such and such grams left over for the rest of the day. So if you kind of look at it like a budget of sorts, you can really like achieve a lot with your health in that way.
And you can buy yourself some calories by exercising.
Exactly, that's so true. Yes, that's a very good tie into that. You can buy back.
Excellent. Joey, thanks for joining us.
Thank you.
I'm your host, Melissa Hodgson. We've been talking today on our program Healthy Living with members of the Community Wellness Center staff. The Community Wellness Center is excited to take a grant from WIC and the CDC and turn it into 3 exciting healthy lifestyle programs here on the North Shore. We've talked about Eat Fit North Shore, grocery store tours, and community gardens throughout West St. Tammany. We're very excited about these programs. We encourage you to visit stph.org or give us a call at 871-6085 at the Community Wellness Center or 898-4000 at the hospital. Thanks for joining us on Healthy Living. We'll see you next month.
When it comes to your family's health, you want the best. That's exactly why St. Tammany Parish Hospital and Ochsner are now working together. By uniting 2 of the highest quality healthcare organizations in the state, we can bring everyone in St. Tammany Parish a higher level of specialty care with advanced procedures and the most advanced technology. Because when your healthcare is better, so's your life.